Matabeleland AIDS Council, MAC, is an AIDS service organization established in 1988, headquartered at number 97A Josiah Tungogara Street in the city of Bulawayo, and we also have a sub-office in Ntumbane at the Ntumbane complex, which caters for clientele from the western suburbs. The organization has operational offices in Plumtree Town, Ngai District, Lupane District and Wangei District. MAC has a qualified and highly committed staff complement of 20 women and 24 men. The board sits 5 men and 5 women and is currently chaired by Mrs. Timbili Ngube, the General Manager of Zim Papers. Being membership-based, we have a vision of being a vibrant organization accountable for sustained empowerment of communities coping with the impact of HIV and AIDS. MAC has the mandate of capacitating and empowering organizations through adopting a client-centered approach of providing prevention and mitigation services in order for them to initiate and manage sustainable responses to the impact of HIV and AIDS within their communities. The organization provides HIV and AIDS services in the thematic areas of prevention and mitigation. Under the thematic area of prevention is the core provision of counseling and testing services, as well as the delivery of the National Behavior Change Communication Strategy, whereas under the thematic area of mitigation, MAC addresses issues around care, support and treatment through its Community Capacity Building Department, which has carved a niche in establishing and capacitating community-based organizations, and to date has capacitated 10 of these within Bulawayo. These organizations provide an array of services within their communities, including home-based care and orphan care. Projects have not only been implemented in Bulawayo but in other districts, with 400 home-based caregivers having been trained and currently mentored by MAC in the Insiza and Matopo districts. Youth programs have always been key to MAC. As a result, the organization has established 10 youth clubs which implement the Young People We Care program that was established in 2004 by John Snow International. These youth clubs number 10 to date. The young people are involved in dissemination of HIV/AIDS information, as well as in complementing some of the roles and responsibilities carried out by community-based home caregivers. Other community projects implemented by the department around issues of support include provision of material support to 450 households comprising of the needy and most deserving beneficiaries, such as the orphaned and vulnerable children, people living with HIV and AIDS, the elderly and people with disability. Beneficiaries are encouraged to participate in low-income gardening, which may serve as a sustainable measure after provision of material support has stopped. Housed within the same department is the Workplace Program, whose main objective is to design workplace programs for different companies and organizations in line with the statutory instruments set up by the International Labour Organization. Activities implemented include conducting awareness sessions, formulation and development of HIV and AIDS policies, and assisting in the implementation of these policies. Several organizations in and around Bulawayo have been assisted in this regard to date. The Community Capacity Building Department is also involved in training of individuals on issues related to HIV and AIDS, sexual reproductive health, as well as on issues around gender. Chichi in the Mangwe district, located in the Matabeleland South Province, has a vibrant project on sexual reproductive health and rights and HIV/AIDS, which focuses on empowering women and girls. The department used the Stepping Stones approach to address issues on sexual reproductive health rights and HIV/AIDS in Ngai, Cholocho, and with 7 organizations for people with disabilities in the city of Bulawayo. Counseling and testing services. These are services provided from 5 static sites, namely the Bulawayo office, the Ntumbane office, the Luveve clinic, at the Plumtree Botswana border post, and the Plumtree office. Outreach services are provided in the Bulilima Mangwe, Insiza, Matopo and Ngai districts to complement other MAC projects, implemented in the same areas, as well as to provide a much-needed service to the rural communities of Matabeleland. Averages of 1,500 clients are reached every month by the team. The department facilitates the process of forming support groups for individuals who have received counseling and testing, and has established a network of partners for referrals of clientele after the tests have been conducted. The National Behavior Change Communication Strategy is yet another strategy for addressing care, support and treatment. MAC is privileged to be among the 8 organizations implementing the National Behavior Change Communication Strategy. The main objective of the program is the dissemination of the National Behavior Change Strategy in the district of Matabeleland North Province with the aim of reducing the number of new HIV infections. The staff in this project works at empowering the leadership and communities to address risk behaviors and social relationships that increase vulnerability to HIV infections through the training programs, information dissemination through the distribution of the Information and Education Communication IEC materials, condom promotion and community video screenings. Matabeleland AIDS Council programs are supported by an administrative team that not only provides the necessary support for the programs, but ensures that resources are efficiently and effectively utilized and all set procedures and policies are adhered to. The organization endeavors to continue providing quality HIV/AIDS services and partner with other service providers in meeting with the needs of the community that we serve. MAC would like to take this opportunity to extend its profound gratitude to the following partners who have provided assistance and support in serving the communities of Matabeleland South, North and Bulawayo. Oxfam Canada for supporting projects in gender, women's rights and organizational capacity building. It is through them that the strategy has been developed and launched. UNFPA for their support in behavior change communication project. Population Services International for supporting counseling and testing. UNICEF for their support in the Young People We Care project. The Royal Netherlands Embassy for supporting projects on sexual reproductive health and rights. Action Aid International for supporting the Protracted Relief Program Phase 2. SAF AIDS for their support around issues of gender, women rights and partnering with MAC in the establishment of an information kiosk. World Vision Zimbabwe for partnering in the Protracted Relief Program Phase 2. Global Fund for supporting counseling and testing. Global Fund through SAF AIDS who have provided support for the workplace and treatment advocacy activities. The National AIDS Council for their continued support as a coordinating body. And last but not least, Matabeleland AIDS Council Board, Management and staff for their commitment and dedication to the organization. Ladies and gentlemen, this is MAC on the mark. Thank you.